Hi, my name is Emily. I'm going to be doing your physical assessment today. During your physical assessment, I'm going to be looking at your skin for color, temperature, turgor, texture, moisture, scars, bruising, lesions, nevi, and edema. I'm going to start by looking at your head, looking at the size and the shape, making sure it is midline and symmetrical, and it is. No obvious deformities. I'm then going to move on to inspect and palpate your scalp and your head. Is there any tenderness?
No.
Okay. I'm looking at the hair distribution, hair texture, and color. Also looking if there's any infestations, depressions, lesions, or masses, and there are none. Everything's within normal limits. And then going to palpate your temporal arteries. Is there any tenderness?
No.
Okay. And palpate the TMJ. Is there any tenderness?
No.
Okay. Will you open up and close? And then chin side to side. Good. Checking for subluxation and crepitus, and there is none. And then going to palpate the lymph nodes. I'm going to do preauricular, postauricular on both sides, occipital in the back, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And everything is within normal limits, so there's no obvious issues with the lymph nodes. I'm then going to do cranial nerve 5. If you will bite down for me. Good. Checking the masseter muscle, making sure it is intact. And if you will close your eyes and tell me where this is on your face.
Forehead, nose, cheek, chin, cheek.
Perfect. Cranial nerve 5 is intact. And if you will smile, frown, puff out your cheeks, poke out your lips, and raise your eyebrows. Good. Cranial nerve 7, checking for symmetry, and it is symmetrical. I'm then going to move on to the ears. I'm looking at the position, location, size, and symmetry, and it is symmetrical. It is in a good location. It is not low set. I'm also going to palpate the pinna and the tragus. Any tenderness?
No.
Okay. There's no tenderness and there's no masses. I'm then going to look at the auditory canal. Okay. The tympanic membrane is translucent and pearly gray. And then going to test cranial nerve 8, and first with the Weber test, checking for lateralization. Will you tell me, do you hear this equally in both ears or one louder than the other?
Equally.
Perfect. And then we're going to do the Rene test, checking bone conduction and air conduction. Tell me when you do not hear this anymore.
I don't hear it anymore. I don't hear it anymore.
Okay. Will you face me? We're going to do the other side.
I don't hear it anymore. I don't hear it anymore.
Perfect. Air conduction is greater than bone conduction. And we're going to go ahead and do the whisper test. If you will cover one ear and repeat after me.
1, 2, 3.
Other side.
A, B, C.
Perfect. Cranial nerve 8 is intact. I'm then going to move on to the eyes. I'm checking the eyelashes, the eyebrows, and the palpebral fissures, and there's no abnormalities. I'm going to check the conjunctiva and the sclera. The color is pink and moist, and there's no lesions or discharge. I'm then going to do cranial nerve 2. We're checking visual acuity and central and peripheral vision. So if you will cover one eye and read the lowest letters you can.
F, P, H.
Perfect. And do the other side.
F, P, H.
Perfect. Eyes are 20/20 in both eyes. Now we're going to check peripheral vision. If you'll look at me. Straight on. Okay. And tell me when you can see my finger.
I can see it. I can see it.
Perfect. Cranial nerve 2 is intact. And now we're going to move on to cranial nerve 3. We're looking at consensual and reaction to light. If you'll just look at my nose. Good. The eyes react to light. Now we're also with cranial nerve 3, we're going to look at accommodation and convergence. So if you will look at my pen light. Good. Now look at the wall and look back at my light. Perfect. Cranial nerve 3 is intact. And lastly is cranial nerves 3, 4, and 6. We're looking at the conjugate gaze with the extraocular motions. So look at my light and just follow it with your eyes. Perfect. Cranial nerves 3, 4, and 6 are intact as well. I'm then going to look at the internal structures and the light reflex. Good. Everything is within normal limits. And then going to move on to the nose. I'm looking to make sure it is straight and midline, and it is. And then going to check patency if you will cover one nostril and breathe in and out. Perfect. And the other side. Perfect. Patency is clear. And then going to palpate the frontal and the maxillary sinuses. Any tenderness?
No.
Perfect. And then I'm going to move on to the mouth. I'm going to be looking at the buccal mucosa, the lips, tongue, gums, teeth, tonsils, salivary ducts, the bottom of the tongue, or bottom of the mouth underneath the tongue, the pharynx, and the uvula, and the palate. So open up, lift up your tongue. Good. Everything looks good. It is pink and moist. And if you will stick out your tongue and raise, say ah, ah. Perfect. That's checking cranial nerve 9 and 10, making sure that the palate and the uvula raise symmetrically with phonation, and they do. And then we're going to move on to cranial nerve 12. If you'll stick your tongue out, move it side to side. Perfect. We're checking to make sure that the tongue is midline and no fasciculations, and it is. Now we're going to move on to the neck. I'm going to check the trachea and the thyroid gland, making sure it is midline, and it is. We're going to check the carotid arteries. Good, and they are 2+. And I'm going to auscultate for a bruit. If you'll hold your breath. Good, there are no bruits. And we're going to check cranial nerve 11. If you will shrug against my hands, perfect. It is intact. And we're going to do range of motion with the neck. So if you will flex down, extend, hyperextend, lateral flex. Perfect. In rotation. Perfect. Range of motion is intact. And then going to move on to the posterior chest. So if you will face the back wall for me. I'm going to be looking for respiratory distress, any signs of tripod positioning, use of accessory muscles, tachypnea, cyanosis, nasal flaring, retractions, any of that, and there has been none. She's not in respiratory distress. I'm also going to be looking for any obvious deformities and symmetry. There's no deformities and it is symmetrical. I'm going to go ahead and percuss. You don't have to take a breath. Perfect. I hear resonance, and now I'm going to go ahead and auscultate. Take deep breaths for me. Perfect. I'm going to go ahead and check bronchophony. So if you will say 99 each time you feel my stethoscope.
99, 99, 99, 99, 99, 99.
Perfect. That is within normal limits. I'm going to go ahead and check echophony. So if you will say E, E, E each time you feel my stethoscope.
E, 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 E. E, 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 E.
Perfect. Echophony is within normal limits. And I'm going to do whisper pectriloquy. Each time you feel my stethoscope, will you whisper 1, 2, 3? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Perfect. Everything is within normal limits and bilateral breath sounds are clear. You can go ahead and stay right there. I'm going to check chest wall expansion. So if you'll take a deep breath for me. And let it out. Good. Chest wall expands symmetrically. And I'm going to do tactile firmitis. Will you say 99?
99. 99. 99.
Perfect. And that is within normal limits as well. And you can go ahead and turn around. For the anterior chest, I'm also going to be looking for any obvious deformities and symmetry. There's no obvious deformities and everything looks symmetrical. I'm going to go ahead and auscultate. And take deep breaths for me. Good. Lung sounds are clear bilaterally. I'm going to go ahead and check chest wall expansion in the anteriorly. And take a deep breath. Let it out. Good. It expands symmetrically. And I'm going to go ahead and check tactile firmitis. Say 99.
99. 99. 99.
Perfect. That is within normal limits as well. And I'm going to go ahead and move on to the heart. I'm going to auscultate with the bell and the diaphragm. I will be starting with the diaphragm. At the aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. And the mitral valve, fifth intercostal space, midclavicular line. And with the bell, aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. I'm going to feel for the point of maximal impulse, which is the fifth intercostal space midclavicular line. And I'm going to go ahead and auscultate the apical pulse for a full minute. And I will note the rate and the rhythm. Okay, if you will go ahead and lie down for me. We're going to be doing, when the head of bed is at 30 to 45 degree angle, I will be looking for jugular vein distension, and there is none. I'm going to be feeling for thrills in each auscultation spot, the aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve, and there are no thrills. And they're also going to be looking for any lifts or heaves, and there are none. I'm going to go ahead and auscultate again with the bell and the diaphragm, starting with the diaphragm, the aortic valve, second intercostal space, right sternal border, pulmonic valve, second intercostal space, left sternal border, Erb's point, third intercostal space, left sternal border, tricuspid valve, fourth intercostal space, left sternal border, and the mitral valve, fifth intercostal space, midclavicular line. And with the bell, aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. Okay, I'm going to go ahead and move on to the abdomen. Whenever this is in a clinic, I will be doing all of my auscultating and inspecting underneath the shirt, but for this presentation, I'm going to be doing everything over the shirt. So I'm going to be looking at the abdomen, looking at the contour, and if it is symmetrical, and it is flat and symmetrical, I'm going to go ahead and auscultate for bruits, the aorta, the renal arteries, the iliac arteries, and the femoral arteries. And there are no bruits. I'm going to go ahead and auscultate the bowel sound starting in the right lower quadrant. And the bowel sounds are normoactive. I'm going to go ahead and percuss, listening for tympany, dullness, and flatness. Good. And I heard tympany, and I'm going to go ahead and palpate. Will you tell me if there's any tenderness?
No tenderness.
Okay. There's no tenderness and no masses. I'm going to go ahead and palpate the liver. palpate the spleen. Okay, and if you will go ahead and sit back up for me. And face the back. We're going to go ahead and check for CVA tenderness. Is that tender?
No.
Okay, perfect. You can turn back around. We're going to move on to the extremities. During the upper and lower extremities, I'm going to be checking for overall color, temperature, the warmth, and the skin integrity during both my extremity assessments. I'm going to start with cerebral coordination, the cerebellar coordination. So if you will get your fingers and touch your fingers to your thumbs quickly. Perfect. And if you will put your hands on your knees and flip-flop them over. Perfect. And then touch your finger to your nose and touch it to my finger quickly. Back to your nose, back to my finger. Again. Good. And so the cerebellar coordination is intact. I'm going to then do sensation. So if you'll close your eyes and tell me if this is on your right arm or your left arm.
Right arm, right arm, left arm, left arm, left arm.
Perfect. Light sensation is intact. I'm going to go ahead and do vibration sensation. If you will close your eyes and tell me, do you feel this?
Yes.
Okay. Do you feel this?
Yes.
Perfect. Vibration sensation is intact. If you will close your eyes and open your hands. And can you tell me what this is?
A coin.
Yes. And then tell me what this is.
Pen.
Perfect. Stereognosis is intact. And we're going to go ahead and do graphesthesia. So if you will close your eyes and open your hands again. Can you tell me what number this is?
7.
Perfect. And what shape this is?
Circle.
Perfect. Graphesthesia and stereognosis are intact. I'm going to go ahead and palpate the radial arteries. Perfect. 2+ bilaterally, and check the cap refill. Good. Less than 3 seconds bilaterally. And if you will grasp my hands and squeeze tight. Good. 5 out of 5 for hand grasp. And I'm going to go ahead and move on to the range of motion. So if you will do your fingers, you're going to flex them in and extend, hyperextend. Good. Adduct them together, abduct them out, and thumb opposition. Perfect. And we're going to go ahead and do your wrists. So if you'll flex them down, extend, hyperextend. And you're going to do radial deviation to the middle, ulnar deviation out, and rotation. Good. Range of motion for fingers and wrists are intact. We're going to do your elbows, flex, extend, hyperextend. Good. And we're going to check your strength. If you'll pull towards you. Good. Push against me. Good. Strength for the bicep, triceps are 5 out of 5. And we're going to move on to the shoulders. So if you'll flex them up, extend them down, hyperextend to the back. Good. And we're going to do internal rotation, external rotation. Perfect. And we're going to abduct them up, adduct them down, and across. Perfect. And we're going to circumduct, around in a circle. Perfect. And we're going to go ahead and check the strength. So you'll push out against me. Good. Pull in against me. Good. Range of motion for the shoulders are intact, and 5 out of 5 for the strength. We're going to go ahead and move on to the lower extremities. We're going to check light sensation. So if you'll close your eyes and tell me if this is on your right or your left leg.
Right leg, left leg, left leg, right leg.
Perfect. Light sensation is intact. If you'll close your eyes and tell me, do you feel this?
Yes.
Okay, other foot.
Yes.
Perfect. Vibration sensation is intact as well. I'm going to go ahead and do the deep tendon reflexes. As brachioradialis, this is bicep and tricep. And do the other side. Brachioradialis, bicep, and tricep. Okay, and then cross your leg. I'm going to do the patella. Okay, other side. going to do Achilles. Okay, other side. Okay, and we're going to do the Babinski. Good. Deep tendon reflexes are 2+, and the Babinski is negative. I'm going to go ahead and check the joints. I'm going to check the joints of the fingers, the wrists, the elbows, the shoulders for any redness, symmetry, deformities, tenderness, nodules, crepitus. I'm also going to be looking at the toes, the knees, and the ankles for any redness, symmetry, deformities, tenderness, crepitus, or nodules. So for your toes, I want you to flex them all in, pull them in, there, straighten, extend, and then hyperextend. Good. I want you to adduct them together, abduct them out. Good. And then for your ankles, I want you to flex them up. Good. Straight. Extend them all the way down. Perfect. We're going to do inversion in towards you, and eversion out to the side. Good. And we're going to check dorsi and plantar flexion after you do rotation. Perfect. Now we're going to do dorsi and plantar flexion. Straight. So if you'll pull up against me. This way. Good. And then push against me. Good. 5 out of 5 for ankle strength. And we're going to do the knees. If you'll push against me. Good. Pull against me. Good. 5 out of 5 for the knee strength as well. So you can go ahead and stand up. I'm going to check the dorsalis pedis pulses. You just stay there. Good. And the posterior tibial pulses. And those are 2+. I'm going to check the cap refill. Good. It was less than 3 seconds bilaterally. And we're going to go ahead and do the range of motion for the knees. So if you'll flex, extend, hyperextend. Good. Other side, flex, extend, hyperextend. Good. And then I'm going to check the hips for redness, symmetry, tenderness, crepitus, nodules, deformities. And there are none. There have been no deformities, redness for anything, any of the joints at all. I'm then going to check, face this way. We're going to do the range of motion. And you're going to flex, extend down your leg, hyperextend to the back. Good.
Sorry.
And you're going to abduct out, adduct in and across. Perfect. And you're going to do internal rotation, external rotation, and circumduct in a circle. Perfect. Let's do the other side. Flex, extend, hyperextend to the back. Good. Abduct out, adduct together, and across. Good. And you're going to do internal rotation, external rotation, and circumduct. Good. If you'll turn around, and we're going to do your spine. This way. We're looking for any redness, tenderness, looking at the alignment and the curvature. And it's all good. And if you'll bend forward, we're going to do scoliosis. Good. There is none. So if you'll turn back to me, and we're going to do range of motion. So if you will flex, extend, hyperextend, lateral flex, and rotation. Perfect. We're going to do the Romberg test. So if you'll stand feet together, arms down, and close your eyes. Make sure there is no swaying. Good. And then I want you to walk all the way up. I'm going to look at your gait. Perfect. And turn back and then do toe to heel, looking at the tandem gait. Whoops. A little wobbly, but within normal limits. And then we're going to hop on one foot. Good. Hop on the other foot. That is within normal limits as well. And that is the end of our physical assessment.